All right. We're doing this. Let's go. Dr. Noble, thank you very much for joining us today on the podcast, man. How you doing?
Thanks for having me. This is awesome.
I really appreciate it. Still kind of new to this whole thing. So when I cold called you in I guess I think I sent email via your website. I was very surprised, honestly, to hear back from you.
Yeah.
Mainly just because I was barely starting here, no reputation on the interwebs whatsoever.
Yeah. Yeah.
So when you were willing to meet up and talk, man, I was very appreciative of it. Thank you so much.
Yeah. Well, big spoiler alert. I don't get a lot of interest on the. I, I mean, if somebody emails me from my website, I'm like, wait a second. Is this my mom?
Yeah, yeah.
Uh,
Is this spam?
is this, nobody really wants to talk to me.
Does this guy even live in the same country as me?
Yeah. Yeah. Or like it's somebody trying to tell me how to grow my podcast or something.
Oh
Like,
yeah.
trust me.
Are you on LinkedIn? Like,
I was I was on LinkedIn until I got so tired of seeing people posting things about synergy. And like I was telling my wife, I'm gonna go to a nursing home and I'm gonna go in there and I'm gonna see some of my friends and I'm gonna take a picture of myself, give it a talk in front of all my friends at the nursing home. And then I'm gonna walk out and take a picture of myself in front of the nursing home. And then I'm gonna say, thanks to all my friends at the Green Estate Retirement Community for the synergistic opportunity to share a keynote address with you today. Hashtag synergy. I was
yeah.
just like, it was like a high school yearbook, but worse. Do you know
That's
what
a
I
good
mean?
point. Yeah.
And I thought LinkedIn's the greatest thing ever. I'm gonna grow it. I'm gonna be able to, pitch ideas and bounce things off people. Nope, nope. So my point is, I deleted it off my phone,
Oh, okay.
and I feel
Okay.
faster and more free.
More efficient in what you do. Yeah. Um,
It's just So no, I don't.
no, I have it, and I'm trying to grow within that space, which I'm finding incredibly hard.
Super hard. Yeah,
Because I feel like my audience could be there,
100%
what
they
I'm
are.
talking about.
100%.
But yeah, I every week now that the algorithm knows that I'm in the podcast world, I get a message from somebody like,
Oh yeah.
"Hey, I heard your podcast. Like, I
Hey.
want to know how to learn how to grow 10 times faster or something." And I'm like, "No, I don't. Not really."
Oh, it's like nope. I like talking to my mom and 8 of her friends. Thanks for reaching out.
Yeah.
You know what I mean?
Yeah. And I'm finding out on there it's about who you're connected to, not what you're talking about necessarily. So,
Yeah.
but
Yeah, that's
whatever. So, anyways, to get officially into the show, Dr. Noble, real quick, give us a little bit of a crash course just in exactly into what it is you specialize in and what you do here in the Des Moines area.
Yeah. My wife and I have 4 kids, and I had 3 kids when I came back in 2012. And, we came back to kind of, establish a developmental pediatrics clinic here in Des Moines. So for those who don't know, Des Moines is the biggest city in the state of Iowa. So,
Kind of a big deal.
You're welcome. We
It's
also
the
have a great state fair.
It's the Manhattan of Iowa.
Yes. Thank you for saying what everybody is thinking.
Yeah.
It is the Manhattan. And so we came back because it didn't have developmental pediatric services. So what that is it's a specialty within pediatrics. I'm a pediatrician, but within that there's subspecialties. Maybe like with OT, like there's people who I would assume, or I'm sorry, RT. My apologies.
There we go. I'll forgive you
But
for that
OTs
one.
as well.
Yeah,
Some
yeah.
will do feeding, some will do sensory. So at any rate, so as with many specialties, you can subspecialize. So I went to Iowa City, University of Iowa, after residency to specialize in developmental-behavioral pediatrics. And what that is kind of what the name entails. Like I'm assessing children who have developmental concerns or behavioral difficulties in order to coordinate their care, collaborate with their providers, um, in order to ensure that, they get access to the services that they need. Most of what I do, if I had to summarize it, is the evaluation of the child who doesn't talk well. So autism spectrum disorders is a big piece of that, and the kids who are younger than 4, like that's a big question that people have. That's probably in dealing with individuals who are autistic or have an autism spectrum disorder is probably 90% of what I do. I mean, honestly. And so I'm also a geneticist. So I did clinical genetics as well. And because there's another set of questions there. It's if you diagnose an individual with a neurodevelopmental difficulty, there's a lot of different value that comes from the clarity of that. But then there's another set of questions like where we want to have 8 kids. Are we going to, excuse me, what's the likelihood that we're going to have, maybe another kid with, is there a reason for this underlying condition? Is there autism? I think in most academic circles is understood to be primarily genetic in origin. It's not necessarily a popular concept, but I think it's pretty hard to argue against that. And so there's a genetic component that I think needs to be assessed. So you diagnose a child with autism, or maybe there's an intellectual component or a genetic condition, and then you coordinate care and you manage medications when needed, right? We don't want to do that. We don't ever want to do that, but it's pretty naive to say that that's not necessary sometimes. So that's a long answer to a smart question. That's what I do.
Wow. There's so much we can get into even from that standpoint there. Before we move on, though, I love to get into the backstory of people that I have on the show. Just I think it helps when we dive into the more clinical and professional work that people do. So, from Iowa,
Yes.
born and raised.
Yep.
Small town.
Dickinson County.
Yep. Okay. I don't even know where is that at. I'm not from here, so I have an excuse.
Yeah. It's right next to Clay County, if that helps you.
Oh, yeah.
I grew up in northwest Iowa, so Okoboji, Milford, Spencer, Spirit Lake. My parents are farmers. They're still farmers. And I grew up 7 miles west of Milford, which is, a small farming community on a gravel road.
Okay. Farming never crossed your mind about like, oh, that's something I could do, or
Nah, my dad and my mom both are super smart people. And, my dad kind of inherited the farming vocation. And some of it maybe he wanted to, but then there was some of it that maybe he wanted to maybe do something different. But there's, back in the 70s, 80s, like there's a level of obligation there. Like, so they never got necessarily the chance to go and see and do. And so I took that chance and I took that opportunity, and they were more than happy to give it to me. They're very encouraging about education. So I did it. I was like, okay, I don't have to pick rock and walk beans and like hope that the economy doesn't crash and I lose everything immediately.
Oh God.
Yeah, I could go and do something else that actually just has a steady, okay, I'll try that.
You picked a much easier career.
That's what they tell me. They're like, yeah, you made a great choice. And people are always like, farmers they're so rich with it. Nope. If you have a calculator and an 8th grade education, I can show you it does not work the way you think it works. It does not.
Oh man.
So I'm thankful to have had the opportunities to leave and go back and visit and, but no farming for me. Northwest Iowa. That was your question.
There we go. And then when did you decide that you wanted to go to medical school though? Like that's even like, okay, like you don't want to be a farmer, but even from then, that's still a huge diversion.
Yes, it
from
is.
that type of culture.
Yep. I was probably 17 when I decided what I wanted to do. So I walked across the stage at Okoboji High School, and they read the thing about what everybody's gonna do. They're like, Nate Noble's gonna go to the University of Northern Iowa to study pre-med. Okay. I didn't know at the time that if you're gonna study pre-med, you should probably, no offense to my Panther fans, because they're great, but the UNI Panthers, not known for cranking out pre-med people. If I would have went like for accounting or teach, they do a ton of great stuff there. But like, I didn't know because no one had ever been to college. I didn't know. No one knew in my family. Like, I just thought college, Doesn't matter which college, just pick one. And then if you're smart or if you do well or you're lucky, which is
Mhm.
all three, I guess, you can go on. I didn't know. I probably should have went to Iowa or like, I don't know, maybe a smaller school that's really good. Like Luther's really good at cranking out doctors. Like there's just some,
Gotcha.
Wartburg's really good. So I just didn't know. And so I went to UNI and I got lucky. But my point is I knew in high school.
Gotcha. Well, I mean, I've heard UNI is like the Ivy League of the Midwest.
Oh
Is
my
that
gosh, it's the Harvard of
it's
Black Hawk County. It's that
really?
no one debates that. It's the I met a guy once, cardiologist, great guy, love him. And we were talking, and we were looking at an X-ray or something important. I don't really know what it was. And he goes, "Where'd you go to college?" No, no, no. I asked him. I was trying to make small talk. "Where'd you go to college?" And he goes, "Harvard." Didn't even break his stare. He's
Didn't
just
even
looking at the
break
thing.
it.
And he goes, and then I think he felt obligated. He goes, "Where did you go to college?" And I go, I thought for a minute. I go, "I went to the University of Northern Iowa, which is widely regarded as the Harvard of Black Hawk County." And I just waited. And it hit just the corner of his lips, just went up for a second. And I was like,
Slight change.
I did it. Success. I made you smile.
You broke his concentration.
I broke his concentration. But
reading
yeah.
intercostal spaces and
Oh
just,
yeah. But you're wise to acknowledge the academic acumen of the University of Northern Iowa. Go Panthers. Go Panthers.
So I'm from Texas.
Okay.
No type of cultural knowledge about Iowa schools.
Yeah.
So I went to the University of Houston, and whenever we would, the rivalry there is the Rice University.
Okay.
It's a private college downtown. Yeah.
Yep.
So whenever we would play them in a football game, we'd call them Harvard Rejects.
Oh.
But they would call us UT Rejects.
Right, because there's a strata in college in Texas. I think I've seen some memes about this, right? Like they're just like an order of difficulty to get into, and I didn't know any of that. I was like, whoa, I didn't know that there was like that.
Apparently there is that. I didn't know either. Who's UNI's rival? Is there a rival for you?
They have no rivals because they have no equals.
They have no equals.
No, I honestly I don't know. I think they're like a Division I AA or something. So it's probably like Mankato. I honestly don't. Like North Dakota, South Dakota has some great schools. Southwest Missouri State's probably one. I don't know.
So you go to UNI, and you had said in hindsight you wish you probably would have chosen, I guess, as far as pre-med goes, a different route. But did it really make a big difference going to UNI? I mean, no.
It's kind of like with all things, like whether it's a success or a failure, like it all leads you to where you are. Like, let's say I went to the University of Iowa. Well, I wouldn't have met Heather Kennan, and then I wouldn't have fallen in love, and then we wouldn't have gotten married. I'd have zero children. I'd be like some weirdo driving an old Land Rover with like a dog. And not that, no offense, like I want that guy's life, like I do, but I don't know. Like I just, talking about myself in third person a bunch, and I don't know. I'm not interested in that. So you're right. In retrospect, it would have been made more sense, but I'm very blessed. I mean, the way it turned out.
So at the end of the day, for that high schooler that might be listening, it's like, well, I do want to be a physician. I do have a passion for this, but I don't know if I'm quote unquote smart enough to get into X school or Y school.
Yeah.
Does it actually make it a little bit easier? Like if that person were to go to Luther or Wartburg, or if they were like, you know what, I got into U of I, I'm taking it, I can figure it out once I pass that part of the journey.
Yeah. Here's what I'll tell you. We've all heard kind of the sage advice of recent times where people say, listen, it's probably not a wise idea to study to follow your passions. I think people kind of understand now that's probably not, because you can be passionate about a great many things, right? Like I can be passionate about whatever. You could be super passionate about this podcast, and maybe it takes off, maybe it doesn't, but like, or basket weaving or high fives. But what I tell my kids and, young people in college, I say, listen, there's a level of aptitude that you have to have. Okay. You have to be able to pass tests. You have to be able to pass really hard tests. You have to be able to at least obtain a certain level of performance academically. But you're far better off to dig deeper and ask yourself, who am I when I'm at my best? Like, I'm much more interested. Like, if we're on a plane, you and me, I don't really care about what you do. I'm not really interested in your vocation. I want to know about the last 5 books you read. Teach me about what do you really, and I know it's not you. I just said, you don't want your vocation necessarily to be based on what you're totally passionate about. I'll clean that up in a minute, but like, I want to know what you are passionate about though. Like, I do want to, like, what turns your crank? Like, what are you excited about? Let's talk about that. I don't need to I don't care if you're a neurosurgeon or I just want to talk to you about that. Um, and I think um so passion has its place, but I think aptitude is probably where you start. Like, what are you naturally able to do and do well, right? Because when you're really, really good, like for you, you're an RT, you're a respiratory therapist, right? You're doing pips and peeps and bleeps and blips and all the stuff. R2D2's there. A lot of the people are there. There's a lot of stuff, a lot of percentages. Um, and like it's once you're really good at turning the knobs and looking at the thing and the chest and the CO2 and all the stuff, you get your aptitude level gets maximized. You're really, really good. And then it's really, really easy at that point, from my perspective, you break through the clouds of aptitude and then you begin to experience the passion that comes after that. Like for me, I don't wouldn't say that I started out my career exceptionally good at assessing autism in an individual, but I was always really good with kids. It was just like easy. So I'm like, well, I got to do something that builds on that. Like, I like kids more than I like adults, much more comfortable. Not in a skeezy, weird way, but in just like people like puppies. Some people don't like dogs. Like, most people do. Like, most people want to be good with kids, but truth be told, not everybody is. Some people are just really embarrassingly bad at dealing with children and how to make it. It is. It's bad. Even pediatricians like, wow, you're just not good at this. You're just really not good at this. But once you build your aptitude, then it's easy to become passionate at that point because you understand where the nuances are, what people don't understand, how to make this feel better. And so, in summary, for a college student or a high school student, start with an aptitude. What are you naturally good at doing? I'm not interested in watching you remediate your weaknesses. Like, we're past that. I'm right-handed. I'm not going to be left-handed. So why would I say, well, my weakness is over here, so I better do the thing? Nope. I'm just going to get really, really good at this one. And it's the same with, I think, all things. Like, just follow the thing that you're naturally good at that comes easy to you. And once you master that to whatever degree is you're able, what comes next is passion. Then you become a truly formidable professional. You become somebody who can take something from nothing to something. You can build something. You start to see things differently because you're not so like, oh no, what's the pips and the peeps? And I'm so stressed. And oh no, those things are easy now. Now you're asking a different set of questions. That's what I would say to a potential medical student is, what are you naturally good at and who are you when you're at your best?
Yeah.
And then go that way.
Gotcha. Real quick, do you want a glass of water?
No, this is my natural 50-year-old smoking voice. Whenever I talk to people on the phone, they always think, and this is no offense to anybody, but like they always think I'm like a 65-year-old smoking female. Because I just have this like high, raspy tenor Bryan Adams, but ran out of gas and got addicted to meth kind of a voice. Do you know what I mean? Like,
Yeah.
That's what I'm working with. So thank you, but this is me.
No, I was just wanted to check. I'm trying to be a good host
You're
here.
great. You're great. This is so great.
Appreciate it. Very kind words. So after you and I, what's the next step? You got to get into med school, obviously.
Yep. You know what happened? So after you and I took a year and did ministry.
Oh, okay. I did not know this.
Yes, I did. I went and worked at a Bible camp for a year. And I was applying to medical school and I was doing all this stuff, but like I learned to get good at guitar, ish, air quote good. I was a speaker, so I spoke every weekend at all these different groups of kids, and I was in the skits, and it was awesome, man. That's how I met my wife, and we really grew that relationship. But then I got into medical school at the end of that, and then I went. But that's what I did, and it was awesome. Like, it was it was a great, I wouldn't have traded that year because it made me really good at stuff that I would not have been otherwise really good at.
What made you decide to do that out of graduating?
I did, instead of the traditional, like, I did apply to medical school. No, I think I chose to take a year off. I chose to take a year off before I applied because I think I just spent my summers doing like ministry and stuff like that. So I was doing church camp stuff in the summers. And I should have been working in a lab and studying to take my MCAT and doing all that stuff. And I was like, I'm just going to take a year off after college and just work whatever and study then. I just want to do this now because it felt right and it was good and I was really into it. So that's why. Yeah. Yeah.
Now, when applying to med school, where were you ideally hoping to
Oh,
go? I
yeah.
mean, like
Let's
how
talk
many?
about this. Let's talk about this. So I, try to think how I say this. So, okay. When I applied to medical school, okay, there's kind of two frames of thought there. There's apply to schools you could possibly get into, okay? And then there's a whole nother set of schools, which in my case was most all of them, that you're never going to get into. And I couldn't stop myself. So what I did was I applied to schools I thought I had a fair chance at. So, really good schools, not that they're not great, but local schools like the University of Iowa, which I knew was still probably a pipe dream. Des Moines University and osteopathic school, which is also, really all of them were pipe dreams. But then I also applied to like Harvard and Stanford. Like, I'm like,
Why not?
and the
Let's
reason
go.
why is because I refused to believe that I was not worthy's not the right word, but I refuse to believe that I should settle for less than the best. I refuse to believe that. And I knew they weren't going to let me in, but it wasn't going to let it be because I was afraid to try. Like I wasn't going to, I don't care if I send you $50. I know you're just going to keep it and laugh at me. I don't care. I'm going to do it. And when you send me the denial letter, I'm going to save it. So if you came to my office, you would see two things on my walls. You would see diplomas, and then right next to them, you'd see framed denial letters. And I put them right next to each other. And I love it. Like those are the two things that I don't even care about the diplomas. I don't. They don't even really value. I don't value that. I value the denial letters. Like I love it. I have the diplomas because I was the first college graduate. So my mom wanted me to frame that stuff. I was like, okay, mom, I'll frame it. I'll put it on the wall. It's for you. But the denial letters, those they got a frame from like Home Depot, but they're on there and I'm pretty proud of them.
I was just about to ask, was the frame bigger? Were they more?
No, they're just 8.5 by 11 and they're stained with tears and coffee and all this stuff.
Slightly crumpled up, and then you had to iron them back
I was
out.
like, you're going to be important later, so I'm going to keep you.
That's not the only thing that you print out, right? You also print out, don't you print out like the negative comments that you get on your channel?
Oh, yeah, I do. Yeah. I mean, I put them in talks because I think people need to see. I think people need to see two things: the absolute blinded bravado of Snake 5000 underscore 282974. I think they need to see that person is super brave and super insightful when they're anonymous, right? And I'm not anonymous. You can find me. I'm right here, right? So the beauty, I think, of creating a persona like what you're doing, I mean, that's how I would see it. Like when I'm doing with my stuff, it's like you really have to know your stuff. You do. You have to be able to stand by what you say, what you believe. You have to be okay with your contrarian beliefs about certain things. Otherwise, why would people listen to you if you don't have anything new to say? Like, right? But then you develop thick skin. Because as a physician, I don't get, maybe I'm sure people are always happy to see the RT come. Like I can never, you're like, wait a minute. I know in the jobs I've had, I was always happy. So I was like, oh, thank God RT's here. This is going to be great. So great. But like, as a physician, you get criticized more now. I mean, oh my gosh, it's like you think that my clinical life is like a YouTube channel where it's like the people's expectations are hard to meet, and anyway. But when you put stuff out on YouTube, people just hammer you, and they'll just find the most unique things to be mean to you about. It really is a glimpse into culture, a little bit of baby glimpse. So I like to take those comments and put them in talks and be like, yeah, this is what people think about me, just so you're clear. So whatever you're thinking, I probably heard some version of it before, and it's probably not as mean as that. So let's skip that.
They don't have a profile picture. They don't have.
No. It's always like and whenever I go to their YouTube channel, because you can click on it and see, they've always got like 2 like videos of them like playing some kind of weird video game, like, and they're like and like talking about their video game they're playing, and I'm like, yeah, this is the person that's criticizing me, and that's fine. I don't write anything bad. I tend not to give. I don't like to platform people when they're just being terrible. Like I don't do any of that, but I do like to just sneak in there and be like, okay, this is who we're dealing with. That's fine.
Real quick, I'm gonna reset that camera just before the time.
Mm-hmm. Mm-hmm. I wore a diaper on the way in here, so I wouldn't have to go to the bathroom at all.
Okay.
Is that okay?
So a slight.
I'm just letting it happen. Well, actually, but it is an important point I want to make. Like, I always tell my kids, I'm going to try and put myself in a nursing home as soon as possible. Like, I'm still going to work full time. This is my plan.
Okay.
I'm still going to work full time, but I'm going to go to a nursing home after work, and I'm going to sit in the parking lot, and I'm going to get out. I'm going to stand in front of the thing, and I'm going to light a cigarette, and I'm going to tell somebody that they need to go and get a diapers because I just dropped a freshie after work. I'm just going to stand there, and they're going to be like, why do you live here? You've got a family. And I'm like, yeah, I know, but they're grown, and I'm sick of dealing with my yard, and just skip to the end, would you? Just change my biscuits and let's go watch Jeopardy.
You still have to go to work tomorrow. Yeah, I know, but
just shut up. Just shut up. I know I'm not trying to be mean. I know this is weird, but just do it. I'm skipping to the end of the story.
I wear a size medium, just so you know.
Just do it.
I prefer this brand.
Grab a couple of cold ones out of my cooler. I'm gonna sit out here. I'm gonna figure it out. I mean, I'm not trying to make fun of the the aging community, but one of my starts was in the nursing home world.
Geriatrics
I was
community
a
is in an uproar right now.
And and I just so I'm like, that's it. I'm gonna do that. I'm gonna as soon as I can. I'm not going to a 55 and older community. I'm going straight to the nursing home, like the cheapest one I can find.
Not the assisted retirement. No,
I don't. Nope.
Yep. They shuttle you to the golf course.
And I'll just wear a cowboy hat, and I don't normally wear one, but I'll just be like, as soon as I get out of my car, put on that cowboy hat, some boots, right in front of that thing.
Just a poncho.
Yeah.
Yeah. Just the poncho.
Harmonica.
Yeah.
They're looking at me outside. Dang it, he's off work. Why is that guy living? He's 54 years old. I don't know. He pays. So what? Just go change his diaper and let's go.
With your diaper. Poncho, diaper, boots.
This is offensive. I'm being offensive, but I find it to be fun.
It's okay. I can cut it out. I mean,
you do you. I think that's internet gold, but it's true. That's how I feel.
Might be. How do we even get back on track?
Good. I felt so good.
There we go. I appreciate it. So you were discussing about when we were talking about chasing your passions, but then having to have an aptitude.
Yeah.
Knowing what you're good at.
Yeah.
And then you said, well, you're good with kids.
Yeah.
Okay. You could have just been pediatrician, cool.
Yep. 100%.
Clinic, 9 to 5, see kids for rhinovirus.
Yep. Yeah.
And, all the typical things, getting their vaccines in, call it. But you chose to go a little bit more nuanced in the developmental pediatric world.
That's it. Yep.
So why did you say, I'm not just going to settle to be a plain, well, I don't want to say plain pediatrician.
Yeah, no,
that's rude.
They're super valuable.
But developmental pediatrician at that.
Well, here's what I'll say. I'm sorry if I'm messing up your audio. This gets to kind of the other thing. You have to have an aptitude, but you also have to know who you are when you're at your best. And when I am at my best, I'm in situations where the ability to communicate an idea clearly, concisely, and be able to read the room is super high. Like the value on that is high. And you'd be like, well, that's everything. It's not. It's not. I could have been in the worst mood possible, and I think it's okay if the barista misses that. That's fine, But there's certain fields in medicine, you don't really have to be great with how you say things, right? Maybe I'm being not fair there, but Developmental pediatrics is great because, I mean, Katie, hold on. Katie's calling me. I thought I silenced this. I did, but it still rings. So there's a conundrum for you. Um, but what I'll tell you is I knew that I had to be in a career path where it celebrated who I was at my best. So I needed to be able to flex the muscle of communication and kind of social IQ. Yeah, I'm saying that, and you're like, this is the weirdest guy I've ever met. He's awkward, has fleeting eye contact. Okay. All right, fine. I am a little, okay, fine. But like, I needed to be in a field where that skill set mattered. Do you know what I mean? And of course it matters in pediatrics. Of course it matters in all things, but it didn't matter to me. Right. So like when I was on the peds floors as a pediatrician, I wanted to see patients where maybe there's a threat that they were going to leave against medical advice, or maybe the dad was a little dicey, or maybe the mom was super weepy, or the kid was really mouthy. I just wasn't interested in the blips and the bleeps and the drips and the drop. I just didn't, it just all felt super medical. I was like, maybe I chose the wrong career path, but I wanted to go into the rooms where how I said things mattered. And you had to be able to really be careful what you needed to say and do. So I knew I wanted to go into a field like that. So first thing. The second thing was I knew I didn't come all this way. And this is not being critical to any specialty, but this, you asked me about me. So this is about me, internet. So be nice. I needed to go into a career that I knew that my presence was going to be incredibly valuable within a community setting. Like, you can have hail, right, that hits the earth, or you can have an asteroid that hits the earth. I'm like, I'm not going to give up all of my 20s, half of my 30s to be like a hail or a raindrop. I'm going to hit a community like an asteroid hits and it's not because I want to be important. It's because I want to have an impact. Do you see what I mean? And people can say that, and they're, well, you can do that as a pediatrician. I get it, but this is about me. This is about me. And I knew that I needed to choose a career that it was going to really matter if I showed up to work or not, because I wouldn't have any colleagues. Like when I started in Des Moines, it was probably a year and a half, maybe 2 years, maybe more, where I don't think I took call every day. Like every day I'm doing the stuff, and it doesn't make me special, but I knew that there was no number two coming around, no assist, no helper, no partner. I mean, I have those now, right? But it took a long time. So I knew that if I was going to do all this work, it had to matter to the community and it had to matter to me. And Des Moines did not have a developmental pediatrician. And we're talking about 17% of the pediatric population. 1 out of 31 kids has autism. 1 out of 9 have some type of ADHD or learning problem. Like these are not small problems, right? And you say, well, that's what psychiatrists are for. They have an incredible role, but there's a big chunk of this pie that requires a little bit more thought or a little bit different thought. And I wanted to come to a community where I could do that and get back to my state in a way that could fill a void that would matter. And then the third thing I'll say, and this is where I'll stop, is I believe very firmly that I needed to pick a career path that exercised the pioneer spirit, right? So like in the early 1900s, I'm going to get this wrong because I just read this book, but there was a group of, I'm going to think, maybe I'll skip this story. Maybe I'll skip this story. Maybe I'll use a different metaphor. But, like when let me just say it this way. The pioneer spirit is essentially like seeing the value in something that nobody else wants, right? So whether it's like, the Mormon community who gets kicked down the road until they land in Salt Lake and like, we'll just stay here. Well, it turns out Salt Lake is beautiful. So way to go. Right. It's the, it's that kind of idea. And I wanted a career that would allow me to come to a community where there's plenty of opportunity, right? So let me land the plane. Iowa has 4 feet of black topsoil. Okay. Like depending on where you are. I grew up in Northwest Iowa, 4 feet of black topsoil. So I didn't even know what clay looked like. I'd never seen it. I came to Des Moines. I'm like, what's clay? Isn't that like you make pots out of? Turns out that's most ground around here, just clay. But I came from 4 feet of black topsoil. So it's Iowa. Anything you put in the ground, most of it will grow because it's just rich, deep soil. So you're really only limited by your imagination here. And so I saw Des Moines, like I saw all of Iowa, just 4 feet of black topsoil. Like you could build a beautiful developmental center here, and nobody's going to even bother trying to compete with you because it just is a money losing venture, which it is, by the way. But it's like it's a pioneer spirit. It's wide open. Nobody's going to fight me for this. No one's fighting me for Salt Lake City. Like I'm just going to live here because nobody else wants to live here. That kind of mentality. And that's kind of how I landed on that.
Gotcha. So you had just mentioned the numbers. I believe you said it was what, 1 in 31 children,
Yep.
and then
right.
1 in 9 have at least some sort of ADHD
That's it.
type of symptom.
That's correct.
Is that are the numbers any different in Iowa? Are they lower than the national? Are they higher than the national? Or is it pretty much the same across the board?
I think that's kind of just a delusional estimate based on the data across the country. I would say we all see about the same amount. There might be pockets where they're better at detecting or better at referring, but in general.
Yeah. Now, what does a typical exam look like when a first time parent, kid, family comes into your office, or they're scheduling a call with you virtually?
Yeah, right.
I know. So I've been watching your channel on YouTube.
Yeah,
Shameless plug for
it's
Dr. Nate Noble. He does have his own YouTube channel where he talks about these things in much more depth. But you talk about how, going back to the gifts that you've got, you're speaking to the child, you're seeing how they interact.
Yes.
And then while you speak to the parent, you're also seeing what the child does
100%.
when you're not focused on
100%.
them.
Yes.
So give us like a little kind of crash course what that initial exam looks
I
like.
will tell you that in medical school, they need to add 2 disciplines to all curriculum. The first is magic. Okay. The second is sales. Okay. Because let's talk about magic first. Why does magic work? It's not real. It's not real. Why does it work? Some people pride themselves on trying to find the trick, but most people are just interested in the treat. And the treat only works because we can divert you. It's always a smoke and mirrors. Look over here. And now I'm doing this, right? And we all know it, but we still love it. It's an art and it's beautiful. So I'll start with magic first, and then I'll talk about sales. When I come into a room, the first thing I'm trying to do is flood that environment with new and novel stimulus. Offensive, awkward, like, is this guy in the wrong room kind of stimulus. You'll never, I rarely will knock and come in. There's probably somebody back here thinking I'm trying to get, and
that's actually the bathroom, by the way. You just know. I'm just kidding.
It'd be weird if somebody came out of there.
Yeah.
What? So new and novel. And what I mean by that is, the quickest way I think to get a good idea about what you're dealing with a person is to surprise them, not scare them. I'm not saying scare. I'm saying surprise. Okay. Now, what do you do with new and novel stimuli? Because children in general are programmed to process new and novel stimuli in certain predictable ways. It's either going to be looking at me, looking at their parents, looking back at me. So I walk into a room. I usually knock because I'm not an animal. And I open because I don't want to crush a child when I open the door. And I usually just walk in. I just do this. Just like that, super awkward. You're the mom, you're the dad. I ignore you. I never do this. Hi, welcome to the clinic. I'm Dr. Noble. Thank you so much for coming. Like, I got 60 to 90 minutes. I'm going where the gold is. It's not me learning your name. I don't need to know your name. You don't need to know mine. What I need to know is what we're going to do with this kid. So can I just skip to that, please? And people are usually fine with it. So I come in, and new and novel tells me right away, do I push forward, hammer it, or do I pull back? Because if you got a kid who's got a neurodevelopmental challenge, they might see me and they're either going to be, most likely, they're going to be indifferent to that most of the time. I mean, I'll be like, I'm making eye contact with you. Why is my arm up? Like, this doesn't even make sense. Sometimes I'll walk over and I'll get some bubbles. I've not introduced myself to anybody. I just start blowing them. Why? Because I want to see what that kid does. And this tells me a lot about parents too, because very quickly I'll start asking the kids some questions, just basic yes, no stuff. You want some bubbles? Hey. And they'll, maybe they're not interested, maybe they're not making eye contact, maybe they're stimming, maybe they've ignored me. And then I'll quickly, because again, I want to make this smooth and easy and painless for families. I'll say, okay, so you're not interested in bubbles. I get it. No problem. And then it tells me a lot about parents because parents will use, if they understand the game that's being played, they'll be quiet. But the parents that struggle are the ones that like, they want to intervene for the child right away. So it tells me a ton about them. Say hi, say hi, and that's fine, and I get that, but, like, I don't require that from you. What I want is just what this kid can do. I'm not here testing you, testing the kid. And parents usually get it, but sometimes they don't. Sometimes they just and I love them for it, and I get it, but they're trying to put the best foot forward for the kid on the and so new and novel is typically what I do, right? So I'm blowing bubbles, I'm doing things, I'm acting like a goon. I'll take a ball, I'll throw it in the ceiling until dust falls down from the ceiling tiles. Like sometimes I'll break stuff. Sometimes I'll take all the toys. We have a bucket of toys, and I'll just dump them out like on my face, all over, and I'll just grab them and I just start throwing them over my shoulder. Like just it sounds dumb, and it is. Okay, internet, it is dumb, okay? But you asked. And then I'll, like, take a bunch of hand sanitizer. I'm looking at the kid, and I'm frowning, and I just keep pumping it until it flows all off my hands and all over my scrubs and onto the floor. Like, it's the dumbest thing. But you're a smart guy. It tells me a ton about that kid. And there's no, like, awkward, "Let's do a formalized test. Feed the baby. Feed the baby." Like, that's the test they want us to do. They don't it's not useful to me. What's more useful is I'm gonna dump these toys on my face, throw a ball out the room, I'm gonna have them fire one of my staff. That's one of my favorite things. I have a kid come out and say, "Pick somebody to fire." Just pick one. It's usually Elaine. If Elaine's watching this, say, "See Elaine, tell her to get her stuff and go home." Let's do it. She loves it. Tell her to get out of here.
I'm sure she does because she gets to go home.
I'm like, "She's not doing a good job. Trust me, she needs to go."
JK, Elaine, you're doing a great job, Elaine.
Elaine,
I've never met you before, but I'm gonna vouch for you today.
She's not doing great. So that's the magic part, right? I'm just diverting attention. That's all I'm doing. By the time I'm done with magic and balls and acting like a goon, 7 to 10 minutes, and I've got more questions. But I'm kind of done here. Like this falls into 4 categories, and I've already decided which one. Not because I'm good at my job, but because I'm a big enough of a goon to get there quickly. Do you know what I mean? Like there's a lot of different ways to get, I guess, into get into a building. You know what I mean? But if I'm willing to kick in a fire exit and the fire alarms go off, but it's faster, like I'll do that. You know what I mean? Rather than wait and enter the key and then beep, and then I could just do that. So I'm doing that, and then comes the sales part, right? And I think it's Robert Cialdini. I think that's his name. He wrote this great book called Persuasion, which, I mean, everybody talks about this book. It's super old. But I read this book and it really opened up my eyes to things that, you probably do naturally, you don't realize you do, like micro sense. Like if I start telling you things that you start saying yes to, like, like if I know this kid's too young for a medicine and I get the sense that that's kind of what you're here for me to do and I don't want to do that, I start saying things like, this is the sales part. There's a lot of medicine prescribed today, and I think nobody's a big fan of that. People start not. Who doesn't say yes to that, especially in kids? Like, right, manipulating the neurochemistry of their brain is made in factories. People are buying their lunches from like a vending machine in the factory. They're not happy because they're buying lunch from it. In my mind, that's what people are doing in factories. And so I'm getting them to say yes. And then when I sell them on, we're not doing medicines today, right? This kid's 3. Like, I get it, you got issues, but we're on the same page. We don't want to be doing that, right? That's what I mean by sales. Or if I know they're going to be opposed to what is a very clear diagnosis of autism, I start selling features. This again, don't judge me, internet, but like the benefits and features of clarifying a diagnosis. There's certain wait lists you can access. You can optimize the closing of the neurocognitive window, the plasticity of the brain, optimizing interventions early to have better outcomes. I start selling that stuff. So then people are like, yeah, those are good things. And then I end with, if we were to use an autism diagnosis today, you'd have the access to those things tomorrow. I mean, you at least get on the right wait lists. See what I mean? That's the sales part. And you're like, well, we shouldn't be salespeople. Name a person who's not. Like, I've never met one who's not selling me something. Maybe it's just selling me themselves. Maybe it's just selling me their perspective or their knowledge. But as healthcare providers, why would we not be the best salespeople in the world? What am I trying to sell you? Decisions that will make you not have a terrible life. We should be pretty good at that. And the truth is, we're terrible. Because all we sell are features. According to the AAP, you should not do this. According to the ACM, you should have low cholesterol. We sell that. But you know what we never sell? Do you want to walk your daughter down the aisle for her wedding? Do you want to chase your grandkids, or do you want to ride around in a golf cart and do it? Like, how do you want to do that? Do you want to take them snorkeling, or do you want to watch from the beach? See the difference?
Yeah, no, absolutely.
Sales. We're terrible salespeople. But we should be a lot better. So magic and sales is what I do in a room.
Yeah, not to get on a big tangent here, but I think you're absolutely right, and you hit the nail on the head so many times. Like so we're a teaching hospital. Unity Point's a teaching hospital too. Like we see residents come in all the time.
The point of Unity is you.
Yeah. Look into the camera when you say that. Yeah, I'll tag them when I
tag UPH. I mean Unity Point Health.
But and this is no negativity towards residents. I mean it's an overwhelming 4 years longer of your life, but the amount of resis that come in that have no sort of like social awareness and aptitude of this idea of sales. And I get it. Like when you say sales, it has a negative connotation to it, but like, you're absolutely right.
Yeah.
Like,
yeah.
I mean, conversations and medical interventions, lifestyle changes would maybe not have a drastic positive change, but there'd be a few steps in the right direction if residents, physicians, ancillary medical workers in the field would just have a much more inept awareness of what we are truly trying to intervene on, right?
Yes.
Instead of saying like, well, the American Association of Cardiac or Pediatrics recommends this, and this.
Right. So am I a robot?
Yeah.
Just ask Claude. We were just talking about Claude's always in a bad mood. You know what I mean? It's like, go ask Claude. I mean, right, because that's the thing. We're getting to the spot where, okay, so let's say you and I want to start a business. We're going to sell online courses. Probably not a good idea. Maybe for RTs, it would be a great idea. I'm just throwing that out because maybe if you got people who are trying to pass their boards, because that's niche.
Oh, that's already happening.
Niche.
Yeah,
okay, so you already have people. See, there's already people. But like in general, online courses probably aren't a great idea right now because people just go to AI or they just go to, we're getting more liberal with what we kind of put out. So there was a time in 2020 where online courses were great. Like, this is the smartest thing we could do. Well, that's not going to work anymore. But like, I had a point to all this and I forget what it was. Something to the effect of, I know what it is. We're getting to this spot where people can just go and get information. It's not hard, right? So why do I pretend like I'm just Chat GPT with skin on, like graying hair and back pain? Like what, that's not the human element that people want. They want the pause and the question that really matters, right? They like I can see by your wife's body language that she's not super happy with your lifestyle choices. I'm betting you got a bunch of years left in the tank. Maybe your gas mileage isn't great on this body, but I bet you can get further faster if you just lay off the Twinkies, brother. You know what I mean? It's just like, I think we minimize that, and you're absolutely right. I think that, again, magic and sales, I don't know why we're not talking about this, because those two groups of people understand something that nobody else understands. They understand the game is actually being played and what people actually want.
Yeah. Even small things like getting eye level with a patient.
Like
100%. If they're in the hospital bed.
Yeah.
Like kneeling, getting on the ground.
Yeah.
Just having an open conversation.
Yep.
Like, those all drastically improve the vibe of a room.
100%.
Especially when you're dealing with providing, like, I'm sure in your case, it's not all positive news.
No, most of it's not. Most of it's not.
So with parents, are they, like realistic. Like they're coming in to have their child evaluated,
Yeah.
and I'm just speaking for myself.
Yeah.
If I'm at that point,
Yeah.
I probably already know what you're gonna
Oh,
say.
yeah. Oh, yeah. It's very rare that people are like, "Huh?" Like, and then then I do this. Where do you think you are right now? Like, let's just zoom out for a second. I just click out on the microscope. You're in a neurodevelopmental genetics clinic referred by your primary care provider to answer a specific question. So please don't get overwhelmed and don't get angry. I didn't drive around in a white van and throw you in it and say, "Hey, let's give you a diagnosis you don't want." Somebody who loves you and cares for you did. They asked you to come to me and I'm doing my job. Like people get fired up, but that's 5%, 3%. And I love them. If they're watching, I love them. But those are usually the people who write nasty letters about how terrible of a doctor I am. Dr. Noble doesn't know anything. And that's fine. You're entitled to your opinion. Most people know. Most people know. They know. I mean, in the United States, between 12 and 24 months of age is when most parents become concerned about an autism diagnosis. When are most autism diagnoses made? 4.5, 4.5 years. Yeah. Even with all our awareness and acceptance, we've moved the needle almost zero, like almost nothing. Years with an S goes by where parents had concerns. Nothing really happens. Now, there's a bunch of reasons for that. Maybe it's there's nobody to refer to, or the provider is either overly optimistic or dismissive. You hear all this, and there's no one solution. Um, but the real value is simply this. It's not, and this is where again it's a contrarian belief I have, kind of contrarian. I believe fully and firmly that the most important thing I can do for a family when they come to the clinic is not affix a sticky note to the forehead of their child. I don't know. And people say, well, of course we're not doing that. You'd be surprised. You would be very surprised. That is what we call a therapeutic intervention. And to be fair, there is some value in clarity. There is, right? You click the camera lens into focus and you can see things a little bit more clearly. That's valuable. Don't minimize. I'm not trying to minimize that. But what I'm trying to say is don't think that there's a period at the end of that sentence. Like I gave the diagnosis, period. If you really want therapeutic intervention, you need to put a dot, 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 right? The value is understanding how to avoid making grammatical errors here, right? Hope isn't a period, it's a dot, dot, dot. So I think I've talked to all of my partners. We all agree on this. The therapeutic the therapeutic intervention is not the clarity of the diagnosis. It's not what this child has. It's what you're going to do about what this child has. You walk in and somebody has a low CO2 and you're like, "Oh, here it is. I put the thing on. Hypercapnia or whatever. See ya." People aren't gonna be like, "Man, that was great. That was awesome." You bring your kid to me. I always say to the families, like, "I think you probably know that I'm concerned that there may be an autism diagnosis here." And then I always say, "Does that surprise you that I would say that?" And then they usually say no. And I say, is this what you expected us to talk about today? And then they say yes. And I say, okay, back to sales. Now I know who I'm dealing with. You are open to what I'm going to tell you next. Versus, I didn't see this coming at all. Well, okay, now we're going to go with plan B. I'm going to talk to you this way now. So we emphasize what we're going to do about the difficulties the child may have, because people already know what the diagnosis is. That's not the value.
Yeah. So so a parent hears the diagnosis, but from your perspective, it's not just you have autism or ADHD versus you don't. It's okay, your child does have some sort of developmental mental limitation now, but then going further into that, there's levels to it.
Yeah,
It's not just yes and no, it's level 2, level 3, it's
that's right.
severe. So
Correct.
give us a crash course, like what exactly do those look like, and then how do you as a physician, like I don't want to say categorize, but it's like differentiate between the types if you can.
That's probably the most common question that I get is once you clarify what people already know, they kind of want to know, like, well, what's the level? Now, levels are a part of the diagnostic nomenclature, but I want you, your audience, to understand that I, as a clinician, I don't put a lot of emphasis on those things because it doesn't help me help you, really. I mean, an individual who has a level 1 autism level 1 is certainly going to need less community resources and interventions than a kid with level 3. And I think that's the point of the levels, is so people understand the types of supports that are necessary to ensure that this child reaches the highest level of independence possible. Because that's the goal. The goal is not they make great eye contact and they told jokes and they gave a talk at their high school graduation ceremony. That's not the goal. The goal is what's the highest level of independence possible? And I don't know what that answer is. I have no idea. But what I do know is that if that we're going to get there, you can't keep talking for this kid. Okay. This kid's got to be frustrated until this kid understands that if noble, I use the babysitter test a lot. I say, listen, if I'm babysitting your child and you're at the civic center because you're awesome, doing awesome civic center stuff, and I'm babysitting and your child wants something, am I going to know what they want? Well, and they usually say no, or we've never tried that. And so that tells me where we're at in terms of autonomy and independence. So a level 3 individual is somebody who's going to need a lot more supports on the front end to get those independent skill sets built, whereas a level 1 person is going to need some independence in different ways, but they're not necessarily. I use this is crass, but I'll summarize it simply by saying this. I use the levels and I think about it in terms of distance. So like I say, okay, a level 3 kid is somebody you're going to give maybe a 5-foot bubble to at a park. You got 5 feet, bro. Like I'm on you because you're going to take off. All right. And now to be fair, all the levels can, it's a crass example, but it makes sense. You don't get a wide berth. You need a lot of supports. You need a lot of hands-on. You need a lot of help with regulating social interactions and the UPS driver and streets and birds and bees and all this stuff. Like I'm right here. A level 2, you got, maybe 20 feet, maybe you're going to give them, you're still there. You're not going to leave them with friends. You're not going to leave them with a college nanny. You're going to you're still around. And then like a level 1, it's like, maybe you're in your car watching from the window because you're taking a phone call or something. Like they're pretty independent on a lot of things. And again, that is not an analogy or an explanation that's going to hold up. Like I just made 900,000 people angry, but it's true. That's how, when you're a parent from rural Iowa and you don't know what levels are, that's a pretty easy way to help people understand what I mean. That makes sense?
Yeah, for sure. So when we started the conversation, you had mentioned that you're also a clinical geneticist. And you said, especially in our current age, there's a lot of environmental factors that we are, as parents or just as in the Gen Pop, we're trying to take out, whether just as an example, like, gluten, dairy, like soy,
Yep.
what's it? Seed oils, this all the trends that are going on right now for parents with children with a developmental delay. Have you noticed in your research, is there any environmental factors that kind of play into a correlation? Or is it, at the end of the day, it is genetics? It is just I don't want to say roll of the dice, but.
Yeah, I mean, it's a difficult question to answer because I have to be sensitive to the person listening to this who's trying to find a unique way to should all over themselves. Okay, you got to be real careful here. The shoulds. So I tell families all the time, like, well, what should we be doing? What should we not be doing? And the first thing I say is, well, you should stop shoulding. First of all, like, don't do that, because all you're going to do is sit in bed at night and should all over yourself. I'm just going to should in my bed. Look at me shoulding. Right? I'm saying this as somebody who's wearing an adult diaper right now. But like, do you see what I mean? Like, if you say the word should, anything that comes after it is probably something that's you're not going to feel great about. I mean, it's like, it doesn't even matter what it is. You're just not going to probably feel great. And we as a culture have gotten so good at shoulding on ourselves that it's just a way that we all just feel terrible. So your question is, are there some environmental factors that could have contributed to the development of an autism spectrum disorder? And we all know that there's been a bunch of, theoretical connections, right? So whether it's fevers and pregnancy or Tylenol, we heard a lot about a while ago, or, in utero infections or vaccines or, dyes and food. There's just a bunch of peripheral issues. But what I would say to you is that we know that from, and this is not my quote, but I think it's some, I don't know who said it, but essentially genetics, 90% is genetic, as I've said. So it's kind of like genetics kind of loads the gun, right? But then something in the environment just tips the scale or pulls the trigger. Something pushes it over. Not my quote, not my concept, but I think aptly explains what it is that you're talking about. So there's a lot of work that goes into this situation that's genetic in nature. And I've got a bunch of proofs of that. But I don't want to say that everyone who's looking for an environmental contribution is wrong. I think we're wise to continue that quest. And right. So like, you don't want to throw the baby out with the bathwater, right? So it's like, let's just go to Tylenol for just a second. People say, well, you know what, Tylenol is bad and don't take Tylenol. And I'm like, okay, I'm not going to get into the proof or the non-proof about those statements, but let's just zoom out again and say, should kids be taking medicine when they don't need to take a medicine? I don't think so. So I like that. You know what I mean? Like, let's not do that. So I think that we tend to throw the baby out with the bathwater too much. Like, we should eat healthier. We should remove certain dyes. Like when you look at what the European nations have done in regards to removal of some of these additives, preservatives, and dyes from what's available to their kids, and you look what's available from our perspective, and how we got just the way that we do things. I think in America, it's okay to interrogate this and ask questions, but I don't think it's always conspiratorial. It's not always like, wow, that tubing in the hospital as well. I don't know that I want people to think about it that way. I see it more as an invitation to make healthier choices so that we can move forward as a nation, as a people, and minimize our environmental risks by, just being smarter, making better choices. But I don't think there's any one environmental factor that from my perspective is worth really getting into with people, because I think about the mom or the dad who's just waiting to should the bed the minute I start talking about, well, if you took Tylenol, or if you had a bad attitude, or if you walked under a power line, or somebody said a swear word, now your kid's you see what I mean? This is how people think. You're like, well, people don't think that way. Yes, they do. Yes, they do. 100% they do. And they don't admit it because they're doctors and lawyers and judges and CEOs. And they come into the clinic and they cry. They just weep because they believe this stuff. Because at the end of the day, your title doesn't preclude your humanity. You're still a person. You're still human. I don't care what you do for a vocation. I shut that door. Stuff happens. You shut that hospital door. Nobody cares who you are in terms of vocation, right? It's more like where you are. Like, you're here and you need some help, and I'm here to help you. So let's stop with the titles and the blah, blah, blahs, and let's just get down to it, should we? So that's how I would answer the question about environment.
Yeah. Well, and I think it's normal for us, as humans, to go down that route, because almost with every other thing in the medical world, at least with physically, when we're looking at patients, it's like, for me, example, why do you have COPD? Well, because you smoked 30 years, 2 packs a day, and you don't exercise, or it is your vocation. You worked as a mechanic since 1965, and unfortunately, that's just kind of the lifestyle, and it's what it brings. Or, morbidly obese, you look at the foods you're eating, the lifestyle factors I mean, as humans, we are naturally pulled towards the cause and effect, and just based upon, us as ourselves. And it's probably just natural for a parent to just think, what could I have done that may have prevented this?
Yep, super common. I usually try, if I'm on my game, I'll tell people 2 things. One, there's nothing you could have done to cause or prevent this problem. Hard stop, period. No more shoulds. We're done with that. And number 2, your kid's going to do fantastic. And I'm very clear on that. And then they're always like, well, how do you know? I'm like, look at my face. Look at me. Do you think I just started doing this? Like, I'm an old man now. I have low back pain. I have high cholesterol. Like, I will tell you in no uncertain terms that when I give people hope, when I offer them an alternate reality, and I'm selling them on a different way to see this situation, people are very quick to remind me of false hope. And then I always say the same thing, in 20 years of doing this work and telling people the most egregious, reckless, irresponsibly optimistic hope stories that I have available to me. Do you know how many people have come back asking for a refund on that? It's 0 people. You know how many people come to the front desk like, where's Noble? I want to talk to him about his irresponsibly optimistic hope that he provides my family. I want to yell at him because it turns out that's not true. Never happens. You know what I mean? But you know what? People in different environments where they make prognostic statements about kids, you've seen this in the hospital, this kid will never walk, this kid will never talk, you should end this pregnancy, blah, blah, blah. I see those stories wrong every day. Every day they come in and people have said the dumbest things to them because they're being realistic. Then they're almost always wrong. So I'm like, what part of the story do you want? You want to be the guy who's like, you're never going to make it to the NBA. Just stay home and be a farmer. Or do you want to be the guy that's like, yeah, I think you could do this if you work hard. I'm going to go with that guy. We get to pick our roles. I'm going with this one. I like this guy. He's a good guy. I want to be that guy. And that's what I tell families. Like, I can't tell you if your kid's going to walk, if they're going to talk. I can't tell you if they're going to work a job or get married or live independently. But what I can promise you is that we're going to squeeze every drop of their ability out of them if you listen to what I'm telling you. The goal is as independent as possible. Be a blessing in the community and be blessed by it. You can be those things and irregardless of your skill set. So no more shoulds. Let's get going.
Mm-hmm. What do you have any examples of families that do have that success story? That
bunch, a bajillion of them.
What is that? Yeah, what does that look like?
Let me say it this way. I'm trying to think what I can share with you and what I can't. Like, I'll just answer your question because there's a bunch of amazing stories that I'd love to share with you. But I was like, the minute I start sharing it, people will figure out like who this is somewhere in the community.
We're not breaking HIPAA.
Yeah, I don't want to be doing that. But like, absolutely, like. But again, like success is where you choose to find it. Like incremental gains are still gains.
How do you define success? Actually,
it's all on, like. And sometimes people will say, well, we're doing all the things and it's not working. And then I have to define, what do you mean by working? Like, be clear with me. Like I never promised you that you would do this and they would come in, reciting, Homer. I just don't know that was what the plan was. It was, are they falling forward? Are they making progress? And are you giving them opportunities to do that are balanced, right? Because what happens is families will sacrifice all their health and well-being to optimize the child's therapeutic interventions for gains, but usually minimal gains. And then I have to come in and say, listen, I'm still after their independence. I'm still after their progress, but at what cost? You know what I mean? If you had 90% of your costs go to 1% incremental gains in your business isn't going to be around very long. Like you really, it's like the 80-20 rule. Like, what are we doing? Like, if you're going to invest your capital in something, let it be in the things that are as good, not only for your child, but for your family. So maybe less of this hyperbaric oxygen therapy. Okay. Maybe a little bit more Disney World. I mean, or getting your finger, a fish hook in the finger. Then we have to pull it out because we're trying to fish, but we got to do that. I'd rather have that rather than sitting in a waiting room for your child's 50th therapeutic intervention while you're searching Facebook groups about, they're just making you feel bad about who you are and what you're doing. Like, how about just go fish? Let's do that. And that's a hard lesson. That's hard for people to get sometimes. So we're not giving up. We're opening up to a more naturalistic and beneficial, reality. Yeah.
When you started your practice, the autism prevalence was about 1 in 88, just rough estimate. Now it's, as of current day, I believe it's like I think you said 1 in 30, 1 in 31.
Yeah, that's it.
So what's driving that number? Is our evaluations becoming more fine-tuned? Are we realizing that, hey, we have to open up the window because what if patient shows these types of signs or symptoms, and what if there's a hyper awareness on this end? I mean, why is the prevalence so much more significant than when you initially started?
If we went fishing today, you and me, we could go into a boat and we could go to Sailorville Lake and we could get some fishing poles and we could bait them with worms. We could throw them out there and we'll catch some carp, something gross. Something that, this is not a story about carp. Okay. It's not what I mean. But we catch a few fish. That was like autism circa 1980, 85, 90. I don't know. Somewhere like, 1 out of 103. That's the you and me are just out there with some fishing poles. There's a handful of people who know what we're talking about. I mean, to be fair, early descriptions of autism go back to the early 1900s. It's not like it's a new concept, but it's changed a lot over the years as you look at the DSM criteria, and it's gotten wider, it's gotten narrower, it's been a lot of different things. So then you and I decide that we're going to throw a net instead of, because it's more efficient. So now we're pulling in a bunch more fish. And then you and I realize that everybody on the lake has a boat now and they're all throwing nets, right? And they're not throwing very many fish back because the criteria has changed, and how we're defining certain criteria has changed. Some boats are their specific role is just catching fish. Like they're just like you and I we're gonna wakeboard, we're gonna do other things. Like, you got more and more organizations that only do autism assessments, and those are great. Like I don't have a problem with those, but like my point is we're getting better at catching fish. And we keep changing what is a keeper and what's a throwback. Like like the DNR don't exist in this game. Like we're just like, just keep them all if you want to. If you think it, just do. So you've got a bunch of more sophisticated tools that people are using to catch. So pediatricians, family practitioners, teachers, social workers, psychologists, developmental pediatricians, psychologists, neurologists. Like there's a bunch of people who are getting really good. And then a bunch more people throwing nets. And then a bunch more places that are able to help quantify whether or not this is an autism diagnosis or not. So I think all those factors together, I don't think there's an underlying, egregious environmental, it's not like a disclosure day. I don't know if you've seen that movie, but it's like, don't see it. But no offense, but just don't. But it's not like there's this hidden secret, like, well, environmental factor that's causing this driving. It's more just like there's a lot more fishermen and fisherwomen now, just a ton more. That's how I would see it. Yeah, and I see more and more kids in the clinic that have been diagnosed elsewhere, and they're coming for what I would argue is the more important thing is management, right? It's like, what are we going to do about this problem? So I don't see more people diagnosing autism. I think can be useful in terms of clarity, but if we're not answering the better question of what are we doing about it, then I have questions for those organizations. Like what do you, like, this kid doesn't sleep, they don't transition, they have self-injury, this is their third kid with autism. What have you done to help with the most important questions in regards to this? Because they already knew they had autism before they came to you. So how do you see this as helpful? And there is some truth. There is some things they do that are helpful, but that's the questions I'm interested in answering, are those questions. Yeah.
How do you think, so your practice obviously is here in Des Moines, and you've come a long way from your own personal clinic that you have. As a whole, though, how do you think our local community is doing in assisting the autism, ADHD pediatric community? I mean, obviously you could say, well, we still have a long ways to go, but I mean, what are some things that you see that we're doing well here in Iowa and Des Moines? And what are perhaps some things that you're like, we need to figure this out?
I think there's several ways to answer that question. I mean, we've grown as a community. There's a lot more therapies available. There's a lot to be proud of, is what I'm saying. But in terms of the way that Iowa needs to grow, all I can do is give you a situation. Okay. And then I'm going to tell you how this situation goes, and then you'll see where the problems are. Individuals with, let's just take autism as an example, whether they identify as autistic or they have an autism spectrum disorder, which those are different schools of thought, but to capture both groups, individuals in those groups can go on to have a number of different great outcomes. But there's a subsect of these individuals that struggle. And I mean, not by a little bit, by a lot. The spending. So, and like an example, if you superimpose on autism, because there's a few clarifying remarks here, individuals with autism don't automatically have intellectual disability. Okay, I think people need to understand that they're different things. You can have an intellectual disability, ADHD, anxiety, a bunch of other stuff superimposed, or you can have autism proper. But if you have the more comorbidities you have, so let's say you have autism as the result of a genetic condition, which is a lot of people. Let's say you have autism and intellectual disability, food selectivity, low vision, constipation, insomnia, self-injury with a body mass index of 35. And you're being raised by a single parent on the south side of Des Moines in a one-bedroom apartment, and you just got evicted. And there's no services for you in the community that will take you because you're aggressive. You're on the wait list to have access to state services, waiver services is what we call them, that will help pay for those community-based services outside of your home, but you're on the wait list. That's a 5-year wait. So you're a single mom, right? You're getting beat up. Maybe you got a second kid who you feel is in danger. What do you do with that kid? I'm not asking, it's a rhetorical question, but you want to know where the rubs are in the state of Iowa? I just told you. And that's not a small amount of people. It's not, I hope I'm being clear. Like it's not, I would say it's a small percentage, but when you look at even just autism and intellectual disability, when you superimpose those things, the expense to the family and or the healthcare community over the lifetime is going to be north of $2 million. If you superimpose those two things. Autism without that is going to be half that. Okay. So the more comorbidities you pancake on top of this, the more community supports you're going to be needed. And then you make that kid big, and you make that kid aggressive, and you make that kid, almost essentially if they've outgrown their ability to be shepherded safely within the family home. So I've had, moms have to run out of the house carrying their babies because they got a 16-year-old who weighs 220 pounds who just blew up, and we don't even know why, because he doesn't have verbal skills. So maybe he's angry, or he told him no, or I've had kids that bash their heads into the wall because they've got essentially a single mom who says, you don't get to play video games all day, or the iPad, or the self-stim, whatever the thing is. And they go absolutely bonkers. And now the mom's got 2 or 3 kids. She's on her own. Like, what's she supposed to do? People say, well, she goes to the hospital. Which hospital exactly? Which one? Okay. Let's just pick one. Doesn't matter. Now, where should they go, to the emergency room? Is this an emergency? What do you expect those wonderful heroes in the emergency room to do? What are they going to do? They're going to manage your psychiatric medications. So then they'll consult psychiatry. Those people are awesome, right? They got one kid who's detoxing from a meth overdose. Got another kid who's suicidal, or got somebody evolving into a bipolar episode in another room. And now they got to try and help a kid who's got a level 3 autism and intellectual disability with minimal communication strategies, who's got a BMI of 32, which is body mass index. Big person is what I'm saying. And so they don't do well in the emergency room. Then you put them in an emergency room with a room the size of this room with techs that aren't trained no functional communication strategies, right? You got none of their workers or their family, none of their preferred items are around. So now they're going bonkers. Just environmentally, they're going bonkers. And so they can't be out. They can't be placed in the community because nobody will take them. But spoiler alert, nobody's going to take them anyways, because there's no place in the community to put people. People say, well, they'll just go to a waiver home. Which one? Well, they'll go to a facility. Really? Okay, tell me more. Which facility? 0. I mean, they're facilities, and they're amazing, and they're awesome. They're doing great work. But to think you can just decide a kid's overwhelmed. We've had kids that have lived in the hospital for weeks because they got nowhere to go. Kids that get put into an emergency room and cared for very well, but cared for in an emergency for days on end because there's no community supports. They're not safe to go to their single bedroom apartment. Nobody knows what to do with them. Nobody wants to take ownership of anything. It's almost like you have to throw your hands up and say, state of Iowa, what do you want us to do? There's nothing. And then I'm going to summarize because I don't want the governor to reach out to me and get mad at me. But let me land the plane. I don't know that I have a solution. Okay. These are money-losing problems. You're asking people to work in facilities to care for individuals with special health care needs and who are aggressive and irritable and who will come at you. And you're going to pay those people less than they would make working at Arby's. Okay. Like that's your strategy. You don't get punched in the face at Arby's. Not very often. I mean, curly fries can be dicey, but in general, you see what I mean? You see the problem? So I'm not trying to say that it's simple. I'm not trying to say, oh, just pay people more. Well, okay, where does that money come? It just opens up another set of doors that nobody can answer. But that's the situation that I've seen in my clinic multiple times. And families will come to me, ER providers will come to us as a clinic, hospital administrators will come to us, and we do our very best to help manage and stabilize, but it doesn't change the fact that we don't know where they go when they leave. And there's no easy answer for that in the state of Iowa. And I'm not blaming the facilities. I'm not blaming the government. I'm not blaming anybody. I'm just saying you asked the question and that's an answer. Do other states do it better? I don't really know. Probably. It's a big problem here.
Ooh. So this question might be might be impossible to answer, and you may have already answered it. But let's say Dr. Noble has a magic wand and and you're given the opportunity to say, okay, let's fix the most immediate shortfall in our community, and immediately it gets taken care of. What is that in your perspective?
Yep. I'm going to say 3 things, 2 of which may make people hate me, but like, again, I'm not here to, okay. Because people ask this question, a donor will come through. I love our donors. Thank you, God, for you. You're amazing. But they'll come through, right? Or a well-meaning, donor will come through and they'll pull me out of to have a conversation. They'll say, what does your clinic need? What are the needs? That's summarizing essentially what you're saying. I say our clinic, our patients, I would suggest need 3 things. Okay, don't get mad at me, internet. This is from my perspective. They need access to Medicaid insurance. Okay, now people say, what, Medicaid doesn't pay well, especially in the state of Iowa. Agreed, but you know who doesn't generally have to pay? Parents, families. I take Medicaid. Okay. Our facility takes Medicaid, which means that we're going to have a longer wait list because we have a lot of people who need that service. And we're not in the business of saying no, okay? But they need access to Medicaid or waiver supports. So community-based supports to help these kids get their needs met within the community, right? So they need that. The second thing I think that they need is, like on the Instapot, there's a release valve. You know what I mean? I'm always afraid it's going to blow my face off. You know what I mean? But you gotta learn. We need a release valve situation. So you got a kid who de-escalates, isn't doing great at a facility, isn't doing great in a waiver home or in their house. We need a place where we can get them, where we can monitor their behaviors, clear them medically, and get to a spot where we can figure out what is the instigating factor here. Because the truth is simply this. See if I can remember this. The 4 horsemen of behavior. It's either environmental, psychiatric, developmental, or it's organic. Okay, those are the 4 horsemen of behavior. So if you have a big behavioral change, you got to get them in a spot where you can go through and interrogate those things. Is this a new onset psychiatric issue? Like, have you spun into like an OCD thing or a bipolar thing? Is there, a developmental component? Like, are you going through puberty? Right? That's a big thing. Or is there, so you've gotten smarter now and you understand that if you fall, nobody can pick you up? Or, is there a medical problem like constipation, vision, hearing, dental? Like, is there something in there that we need to address? So we need a place, and then behaviorally, like, and then we need to, once we've cleared the board of those things, we need to be able to work the steps, gather data, to ensure that the family, the school, the community, the organization knows what the hot button issues are behaviorally and how to mediate those with a plan. We need a place to work on things. You know what I mean? Like a mechanic needs a shop, right? Right now, they're just asking us to come to them on the side of the road with like some metric tools that I have in my glove box. It's like, oh boy, I don't know. Like, you know what I mean? But we need a place to work on this. And the emergency room's not the right place. The psychiatric ward's not the right place. The inpatient hospitalization is not the right place. We need a third way. Those are traditional ways. We need a third way. Okay. We tried to create something like that. Not exactly that thing, but something similar where you can get kids in and just work on stuff, maybe during the day, and then they go home at night and then they come back during the day. We have a plan to address that, but something even more robust than that may be needed.
Do you get that?
No, it's my daughter. And what she'll do is she doesn't care about, I hope this goes on the internet. I hope that she sees this. I could ignore her calls 1,000 times and she will call me 1,001. And I'm just going to say, not now. And she'll say, yep, yep, not now. Call later. And then she texts back, yo. She doesn't care. I'll be in a clinic room. She'll call me 50 times. Like, stop it. So that's the second thing. We need a third we need a third way. We need a third space, right? And then the third thing, and this is where the internet's going to get mad at me, but you know what we need more than it? You know what we need? We need dads. We need dads. Dads. You know how many times I've seen single moms? Now, to be fair, I've got some hero single dads in my clinic. I've got some studs. Amazing dudes. So this is not meant to diminish these dudes. They're incredible. But they're rare. The exception to the rule, they're the exception. 90% I deal with moms and or moms that are either alone or feel alone. And these kids need dads. And I know that that's not a culturally, people don't like hearing that now. And it's like this whole thing about we don't need that. You do. Yeah, 100% do. Yep. I'm not saying everybody has to be married. I'm not trying to be traditionalist in that way. I do believe that, but I'm not trying to put that on people. What I'm saying is having the yin and the yang in a parenting relationship, particularly when you're dealing with a neurodevelopmental disorder, is so helpful. You know, as long as people act like adults, it's helpful. So those are the three things I say. If you can get me those three things, life for most of my patients will get a lot better. And that's not to diminish the number of dads I see in the clinic that are amazing. But if you follow me around for a week, you'd see what I'm saying to you. Mm-hmm. Right.
Yeah.
100%.
So on your hardest days at the end of your shift, you've seen, 8 families, 6 of them have taken it well. 2 of them have just, I'm just trying to paint a picture here. What keeps you going? What keeps you waking up the next day and being like, let's go do this again?
That's a great question at this stage in my career because it's getting harder to answer. You know what I mean? I'm like, what? Because I'm going to answer that, but in general, like you're a builder or you're a joiner in general. Like so I'm a builder. Like I'm like a pioneer spirit. What's the next big thing? Like, let's go, let's build, let's be here. But once you build and you're done building, then you're just like kind of like on a treadmill. It's like I'm not going anywhere. I'm just running a little bit faster every year. It's like that's not appealing. So I'm running out of reasons to answer that question. But I'll tell you that I have a worldview that might help your viewers. And this is my worldview. Okay. I don't know if I had a dream. I can't remember what it was, but it was an epiphany, we'll say. And in this epiphany, I'm in like Hoyt Sherman Theater. You ever been in Hoyt Sherman? It's beautiful. Yeah. So cool. So I can't believe it's in Des Moines. It's so cool. But in the dream, whatever this epiphany is, I'm the only one in the theater and I'm in the front row. You ever have that moment at the end of a production where like Les Mis or whatever, I think that's Les Mis, and like Jean Valjean will come out and you're just like, and you realize this is just an actor. Like, I loved and or hated this actor or actress for 2.5 hours. And then they come out and they're like, and you're just like, oh my goodness, that's not you. It was just, you tricked me into falling in love with you or like hating you. And in this epiphany, right, it's that concept. But instead of actors and actresses from Les Mis, out from behind the stage comes every kid I've seen, one at a time. And they walk out by themselves. And they smile, and people are throwing roses, and they're waving, and they take a bow. And I realize that while this is the way it is on this side of heaven, it will not be like that in heaven. It won't. And people can love or hate this worldview, but I'm very much like a Christian worldview perspective. And the value I have in being a Christian is not the bumper sticker theology of God will make it all better. God answers prayers. That's not really been, there's truth in that. Okay, I don't mean to minimize that. But for me, the true value in the Christian worldview is that moment when we realize that at the end, God makes all things right. And that kid who can't walk and can't talk and just does self-injury or bites his hand for 42 years of his life, that's not the way it was supposed to be. That's the way it is on our side of things. But there's going to be a page that turns, and I'm going to get to sit in the front row and watch that kid get out of that wheelchair. So what I tell families is, I don't know when, I don't know how, but I can promise you I'm right. Because I firmly believe that every knee will bow and every tongue will confess. Like the God will make things right. Justice is not possible without a belief that that is true. Otherwise, bad guys get away with it. Disease just took them. Spinal muscular atrophy sucks. Huntington's is a bummer. Back to Adams. See ya. I don't believe that at all. How could I get up and do this job if I believe that this is all meaningless? Point one. Point two, how could I do this job if I believed that there was some like joke cracking, clean shaven, angry God who's just sitting up there shooting us with BB guns? Say, watch this. Watch this, Holy Spirit. I'm going to crank this button and shoot Noble right in the butt. And I'm going to give his son Tourette syndrome. And I'm going to give that kid this. I'm going to give this kid this. And watch this. How could I get up and do this job if I believe that that's God's predisposition towards us? I don't believe that at all. I believe the third thing is true. I believe that we live in a world that's not heaven, and that heaven is a real place, and it's a real thing, and it's a real reality, and it's available to us. And in that moment, I'm going to be sitting in the front row watching all my patients come out and take a bow, because that the person I knew on their time on earth was not who they were. It was this. I was watching something else, and I'm just freaking clapping. Like it's like the greatest thing ever. That's how I think about this. Does that make sense?
Yeah.
That's how I get through this. Because I'd rather be an orthopedic surgeon. I just put bones back together, and you're super happy with me. Look at Noble. I saw Noble. He fixed the thing. I don't fix anything. I fix zero things. I was in training until I was 34 years old. I fix zero things. Nobody comes back and says, it's gone. It's better. Thank you. Zero people say that. You know? So what do I have? I have perspective. I have this. That's how I do it.
And prepping for the podcast, there's a question I always like to ask. I asked you, I'm going to change it up a little bit. Is there somebody known or unknown that you think the world should know about? Or, because you had brought it up earlier, is there a book that you've recently read that you would recommend to the audience listening?
I read so many books, and then by read, I want to be very clear with you. I listen
Oh,
because
okay.
I can't sit and read a book.
Yeah.
I can barely sit and talk to you. Like this is like I can barely. But I mean, I will audible or go through the library, and I just devour books like one after the next. So there's just too many books to speak to on that one. But I would say that if a person. I'm going to have to think about that one. Let me talk about, maybe seminal works that have changed my life, and it probably, maybe I've already talked to you about this. So it might surprise you. I think that I have 2 or 3 movies and or books that like completely changed my life. And it's not because they're entrepreneur books or doctor books or patient doctor experience books. Nope. The Shawshank Redemption changed my life completely. What's Eating Gilbert Grape changed my life completely. The most recent Frankenstein movie, where you realize at the end that the real monster is not the monster, it's Dr. Frankenstein, and the forgiveness of that movie. It's like, those kinds of works, I think you can find value and direction hidden in plain sight. Those are works that because I've got 100 leadership books I could blot out. And that's not useful to anybody. Right now I'm reading 0 to 1, which is very interesting. Anything Robert Cialdini writes, you should read. But people, man. Oh, golly. people. There's just so many. There's just so many that I can think of that impacted me. But you're asking like, what would have a broader audience? Like, what would people be benefit from knowing from? Like, is that what you're asking?
Nope, just someone known or unknown that you think the world should just hear their name, and then obviously the why.
I'm just thinking of like the thousands of patients that I've seen and their first names, but okay, this guy signed a waiver. I don't know I can't say his name right now because I can't think of it, but you should. There's a guy. I think I can say because he signed a waiver. So I think I'm okay. I'm pretty sure we're good. I remember him signing it. I'm going to close with this. There's a town. Here's how I frame the story. There's a town in Iowa that has no lawnmowers. Okay. There's nobody mows their lawn except one guy, one dude. And he's got a lawnmower. And this is hyperbole. There's probably some other rascals that got lawnmowers, but there's one guy. And this one guy's got this lawnmower business, and he mows other people's lawns. And I don't know, I'm not going to share this story because it's emotional, and I don't think so. But there's some dudes out there I wish that I could tell you their names because they're incredible, and they're like in small town Iowa's doing incredible things. But I don't know. I can't think of anybody specific. I'm sorry, I'm copping out on you. There's so many people. I feel like I'd be a turd if I just highlighted one person. I don't want to tell you that story because I'm like, I don't feel good about it. It's pretty incredible though. Sometime we'll talk about it, I promise.
I'll hold you to it.
Yeah.
It's okay. We got the 3 movies: Shawshank, Gilbert Grape, and then the newest.
Yeah.
Gilbert Grape is always hard to watch for me.
Oh my gosh.
It's a fantastic movie if you haven't seen it. I believe, if I'm thinking of the right movie, it's got Leonardo DiCaprio in it, right? As a young kid.
Yep.
And he plays a kid that has mental limitations. And then Shawshank, that's an all-time classic. It's classic, absolutely. If you haven't watched Shawshank, it's top 10 probably most mandatory movies to watch before you die. Well, in closing, Nate, where can people find you? Where can people access more of the resources that you've got available?
I don't know. I have a podcast, but nobody listens to it. And I don't post regularly because I don't care. I care about the content, but I don't care about like the consistency. Like I just don't care. Like if the algorithm ignores me because I don't post weekly, I don't care. I care about content. What's important to me, what's important to people, and I do that. So I've got a YouTube channel that I do a lot of that on. So if you're like waiting on a wait list to see somebody for a developmental eval, or you have questions about autism or saffron or leucovorin or stuff that people want to know about, I have a YouTube channel. I think it's at Dr. Nate Noble. It's at YouTube at Dr. Nate Noble is my handle, I think. And it's just easy stuff that you're probably waiting on a wait list to talk to somebody about. I probably have talked about it, and that might be helpful to you because it's like, why not? That's the big one. I don't do anything else. I used to do all the other stuff and Facebook and all that stuff, and I just hate all of it. So I just don't. I'm like, I don't really care. If I'm going to make it in this world and break through and have a broader audience, it's not going to be by doing that stuff.
By social media.
Yeah, I'm going to pay somebody to deal with it. It's kind of want to hear about it. I just don't like it. I don't like it. And that's probably dumb as a business person, but I don't have time for that, right?
No, man, who does? I have a passion for this, but yeah, there was days where I'm just like, oh man, I've got to post again today, and I've got to put this clip out, and I've got to
clips and they try and make you feel like AI is going to take care of that for you, but then they just put out slop. It's just stupid. It's like this clip doesn't even have a point.
Yeah, no,
it's like I don't even say anything here, and then. So I would say I have a podcast, like, I think it's called Dr. Nate Noble Podcast, and I have a YouTube channel. That's it. Like I just hyper focus on one thing. I don't really do other stuff.
Yeah. Well, in closing, Nate, thank you so much for coming on to the podcast. I really appreciate it. This was so beneficial, honestly. Hopefully there's at least one person out there that takes this and hears it and then hopefully finds you and their family and what they need. Absolutely.
Yep. No,
So
that's good, man. I appreciate you having me.
yeah. Until next time, everybody, please like, share, subscribe, leave a comment, leave a review. That stuff really helps the channel get out to more people. And until our next episode, we'll see you then. Bye-bye.